Welcome, everyone, to our webinar today. We are very excited to have you joining us for our culinary medicine seminar. This is a very, very special educational opportunity where we bring together doctors, dietitians, and chefs to help us learn about different topics in celiac disease. And it's been such a wonderful pleasure to see this program grow over the last year. And one of the reasons that we've had such great success with it is because of all of your willingness to complete surveys to help us learn about what you want to learn about and to help us understand if our webinars are helpful. And so while we're waiting for folks to join, we would really appreciate it if you could scan the QR codes up on the screen right now. If you're a patient or a caregiver of somebody with celiac disease, please scan the one on the left. And healthcare providers who are claiming CME credits, please scan the one on the right. And we'll give you just another moment to do that, and we will jump into our presentations. Also, there are live translations available in both Portuguese and Spanish. To get access to those, you just click the interpretation button at the bottom of your Zoom screen, and you can access those feeds. All right, Megan, I think we can go ahead and get started. So today's seminar is called Gluten and Celiac Disease, Understanding Exposure, Risks, and Clinical Trials. Today's session is accredited for 1 CEU for both physicians and for dietitians. We have an amazing panel today before we introduce our speakers, let me just say thank you to our proud sponsor, Shar. Shar has been with us since the very beginning of our culinary medicine program, and we're really grateful that they believed in this and have continued to be a sponsor of it and help us grow the program globally. So thank you to Shar for their support. So we have a great list of speakers today. First up is Dr. Vahe Badalian, who runs the celiac disease program at Children's National Hospital in Washington, D.C. Dr. Badalian is a true gem in the celiac community, and you're really in for a treat today getting to hear him speak. I've known him for decades, and I'm just really thrilled that he is here to share some of his wisdom with all of you today. We also have Megan Donnelly McKeon. The first time I got to say her new last name is she just got married a couple of weeks ago. So congratulations, Megan. We're so grateful to have you as our expert dietitian today, who's going to take us through the nutrition lesson. And I won't bore you with anything about myself, but I am also a medical chef. And so I will be doing today's cooking demo. All right, so we'll turn it over to Dr. Badalian.
Thank you, Vanessa, very much. And it's really a pleasure to be here. Thank you for your introduction and invite. And I'm just going to go ahead and share my slides. So we'll be talking about gluten exposure in celiac disease and various aspects of it. I don't have any disclosures. Let me just make sure that my slides move. Yep. I don't have any relevant disclosures. And one thing that I would say is that it's always so humbling to read and prepare for those presentations, because that makes me realize again and again how, despite all these wonderful advances in research and all these clinical trials, how little do we really know about this disease that affects so many people in the whole world. So I'm sure this is very kind of simplified version of what happens with celiac disease. So that in genetically susceptible individuals, gluten crossing the gut barrier triggers the immune system that starts to create a cascade of downstream, very complicated and complex processes involving all kinds of immune cells that overreact essentially, and then they make chemicals that we call cytokines, and that results in intestinal damage and both gastrointestinal symptoms as well as extraintestinal symptoms. Key players involved as far as the cytokines go are interleukin-2, which is basically cytokine that we all make whenever we deal with all kinds of disease processes, but the impact of that is that it stimulates various parts of the immune system that are sensitive to gluten. But what's interesting is that symptoms of patients of gluten exposure, for example, vomiting, abdominal pain, nausea, they seem to correlate in some studies with high levels of interleukin 2. So the more a patient secretes interleukin 2, the more their immune system is activated. It tends to correlate with the severity of the symptoms, as indicated on the right side of this slide, a diagram from a study. So the question is, we all, know that celiac disease has a variety of symptoms. The question is, how do these symptoms change when people go on a gluten-free diet? This is a study that was done in Chicago in pediatric and adult patients. And the chart on the left side shows the patients, proportion of the patients who experience symptom at the beginning of the celiac disease diagnosis and followed during their follow-up visits at year and one or 2 years after the diagnosis and after being on a gluten-free diet. And you can see that the various symptoms decrease in a different way. It seems to be in children on the left side. The top symptom is abdominal pain and maybe diarrhea and maybe some issues with growth. Um,
Dr. Medallion, it seems as though we may have lost you. Megan, do we want to jump to the nutrition piece? And when Dr. Medallion can rejoin, we will have him take over again.
Sure. I am gonna, oh, yep, there it is. Okay. I was gonna say I can't share my screen while he's sharing his, but I'm sure he'll be back. Sorry about that, everyone. Okay, so in building this presentation, I was trying to find a lot of information that doesn't exist. And I think that's a really interesting gap in the research. We don't have a lot of information about what to do from a nutrition perspective when someone gets exposed to gluten. So I'm going to talk through some research that really it's based on other information that we know about gastroenterology nutrition, but not necessarily about what to do when you're exposed to gluten. So I'm hoping that it's helpful and provides practical solutions, but just want to be clear that the evidence really doesn't tell us much about what to do in these cases, which I know can be frustrating because people are looking for solutions. So generally speaking, we tell people that supporting symptom relief is what you should do. So that sometimes that advice ranges from gentle foods, soothing teas, hydrating, resting, using different pain relief methods like heating pads or ice packs, or even different medications if the doctor recommends it. But none of these are really specific, and really the goal is to just treat the symptoms that you're having. The one of the best things you can do is rest and give yourself time. Time is really what's needed for your body to respond and react to the gluten exposure. But there are some things we can do to support the symptoms that you're having from a nutrition perspective. So I was kind of going to take each of these and go through what I would recommend as a dietitian and why we recommend some of these things, because I always think it's helpful to understand the why. So, hydration. This is really important, especially if you're having symptoms of diarrhea and vomiting. But I will also say that hydration is important for generally healthy digestion. the digestive system doesn't move if you don't give it fluid. So just this is kind of an always thing, but especially important when you're having excess fluid loss because of diarrhea and possible vomiting, which are two of the more common symptoms that people report when exposed to gluten, especially vomiting. So our recommendation generally is that most people should be consuming 2 liters of water daily. That is very general. Basically, people, hydration needs can fluctuate depending on the temperature outside, your activity level, a number of things, but this is a good baseline. Your individual needs may be different. And you want to sip fluids throughout the day, especially if you're experiencing digestive distress. Drinking large volumes of water at one time can actually exacerbate the digestive distress. So, sipping small amounts throughout the day is better for hydrating yourself, but also for reducing your symptoms of digestive upset. And then there are other options besides just water, and I'm gonna talk through some of those in a little bit, but things like diluted juices, coconut water, ginger ale, chicken broth, herbal teas, all of these can be nice hydrating options, especially if, sometimes when you're feeling nauseous, you don't necessarily want just plain water. So um, those also count as fluids and contribute to your daily fluid needs. I should have said 2 liters of fluid daily instead of water. And then consider an electrolyte supplement, especially when you've had excess fluid loss because of diarrhea and vomiting. Something with a little bit of sodium and sugar and potassium as well can really make sure that your cells are hydrated. So sodium and potassium are important for making sure that there is fluid actually in the cells, which are the parts of your body that need the water. So very important that you're thinking about electrolytes as well. I like to recommend oral rehydration solutions, especially if someone's been experiencing these symptoms of diarrhea and vomiting. You can make your own. These are 2 recipes that I like to use myself. So you can do a little simple sugar, salt, and water solution. I will say that's maybe not the tastiest option. The coconut water option tastes a little better. Really simple, just some coconut water, some regular water, lemon juice, salt, and maybe some fruit. Could also use fruit to flavor the other version of this that I have on the left side of the slide. So these are just some options you can do at home. Um, there are many oral rehydration solutions available out there, and they are also appropriate in many cases, but I like to make my own. It's cheaper, it's easy, and then you're not stuck with this huge jar of something that you're not going to finish. So just keep it in mind. But those products are often appropriate. We also talk about gentle foods, especially when people are experiencing loose stools or constipation or abdominal pain. And a lot of people, when I tell them gentle foods, they don't really know what I mean. But the idea behind this is that simple foods are easier to digest and may help with symptoms and may make foods more tolerable for you. So if you're not feeling well, for any reason, simplifying the foods that you put into your system can be helpful, especially soluble fiber. Soluble fiber can help improve stool texture, but these foods also tend to be softer, so they are easier to tolerate for the most part. So, just thinking about a recommendation, I tell people to include whole foods that are soft, meaning cooked, mashed, pureed, even blended. And you can prepare them using simple, easy to digest spices. When I say easy to digest spices, that's kind of subjective, but in general, it's things that are not very spicy or acidic. So most herbs are fine, cinnamon, cumin, things that aren't going to cause a lot of fire in the digestive system or in your mouth, really. I tell people to avoid foods that are spicy or high in fat, like fried foods and hot chili peppers. Those tend to be things that are more difficult to digest. And then avoiding high roughage foods. I do want to say that everyone's a little bit different, and some people are going to tolerate high roughage foods better than others. So these are just general ideas. Figure out what works for you. Examples of high roughage foods are things like raw vegetables, whole nuts and seeds, popcorn, fruits with the skin and the seeds, just things that tend to be a little bit difficult. I think corn is a really good example because corn is something that's hard to break down. And so if you're experiencing digestive upset, you're probably not going to crave that food anyways. But just playing around with texture can help a lot. So when I'm telling someone to go on a gentle diet, a lot of times these are the foods I'm recommending. Things like starchy vegetables, sweet potatoes, mashed potatoes, soups and smoothies. We have Vanessa has in her cooking demo part of the presentation a really interesting set of recommendations about broth. And actually, chicken broth can be really soothing, and using it in soups, especially pureed soups, can be a really comforting food. And it also provides a lot of nutrition. It naturally contains glutamine, which is an amino acid that helps soothe the small intestinal cell wall, the lining of the small intestine. And it also contains collagen, which is really supportive for your tissues and your skin and things like that. So I love to make soups and recommend making soups for a number of digestive issues, but it can be a really nice comforting food. Nothing like chicken soup. Um, Smoothies can be helpful. The reason smoothies are helpful is because you're kind of the mechanical pureeing or the blending actually helps break down some of the more complex parts about the food to digest. So some people find that liquid nutrition, especially in the form of a pureed soup or a smoothie, helps with tolerance. I talked about how nuts and seeds might be problematic, but nut and seed butters can be more gentle on the system and a good way to get some protein. Well-cooked veggies. So any vegetable really works here. I find some of the more gentler ones are things like carrots and leafy greens and green beans, and maybe not the cruciferous vegetables. But again, this is all individualized. These are just ideas. And then some high protein foods that work well tend to be things like tofu or eggs or fish or poultry that's cooked either in like a sauce and cut up really small, or even just baked, very simply prepared with some herbs and some salt and pepper can be nice gentle options. You can also put them into soups and serve with some of the sides like I've talked about on this slide. So there's a lot of options, but really things that are simply prepared is the message, and things that are soft. And then, of course, as a dietitian, we're always talking about eating behaviors, but these are things we tell people all the time to help with digestive issues, especially things like reflux, but also nausea and also abdominal pain. Chewing food thoroughly, sitting upright while eating, eating slowly, and thinking about portion size. The rationale here is that you want to break down your food as well as you can when it's in your mouth. So chewing and slowing down can actually help your digestive system um, tolerate what it can more easily. It's helping your body out a lot. So chewing helps physically break down the food, and it also allows for mixing of the food with saliva, which saliva actually contains enzymes which help some of the chemical digestion of the food that needs to happen. So chewing a lot can be helpful. Also gravity, using gravity to help your digestive system. Your digestive system is basically one big long tube, and it actually functions better when you stand upright. So it's kind of interesting. One of the most common recommendations for treating acid reflux is actually avoiding laying down after a meal. But I think the same thing applies when you are nauseous or experiencing abdominal pain related to a gluten exposure. Giving your body the best chance to digest in an anatomically correct way can help with symptoms. And then just eating slowly. I mean, smaller, more frequent meals are often more easily tolerated when someone's experiencing digestive distress. And so slowing down can help your body monitor how much it can tolerate. So it's just these things are kind of standard for everyone, but I think when you're experiencing any sort of digestive upset, these lifestyle things and these eating behaviors can go a long way. And then I was going to talk about some of the things you might see online, things that, maybe seem like they could be helpful, and so what the rationale is and what the evidence says. And I'll be honest, again, in celiac disease, there's not a lot of evidence for the use of some of this stuff, but I'm hoping I can put it into context. And so a lot of times I'll see recommendations for herbal teas. Or people will ask me, can I drink herbal tea to soothe my symptoms? And I think the idea behind this is that it can help reduce inflammation and help with certain symptoms like gas and bloating and abdominal pain and indigestion. And a lot of these tea blends do have different properties that help support symptom relief, but I would say the evidence is limited for their effectiveness. However, warm beverages can be comforting, and there are a lot of health benefits to consuming herbal teas. And so I think in moderation, these can be helpful if you enjoy them. 1 to 2 cups daily of herbal tea may make you feel better, whether it be emotional or physical. So I think there's a lot of, we'll talk about some of the specific ingredients in some of these things, but I don't see a problem with consuming these. And a lot of people that I work with tell me that they're really comforting, and that's one of the things we recommend is choose foods that are comforting to you while you're healing. So maybe not an evidence-based practice, but certainly people report that it's helpful, and I don't see any safety problems with it. Ginger is often an ingredient in herbal tea blends, and it actually is commonly recommended for symptoms of nausea and vomiting. And the rationale here is that it affects nerve signals in the digestive tract. It actually helps the stomach muscles move food more through your stomach more effectively, and improves the stomach emptying. So when you're experiencing nausea, a lot of times that food being in the stomach too long can be triggering of symptoms. And so the idea is that ginger can help improve that. It also contains important nutrients like B vitamins and vitamin C and iron and potassium. So generally speaking, it's a very healthy ingredient. I will say, in terms of evidence, it's a bit limited. Most of the studies that I looked at ginger use in people who were experiencing chemotherapy or who were pregnant and experiencing morning sickness. And these studies largely did show benefit, but there was no standard dose that they used across all of the studies. And so I can't say like this amount is probably the amount you need in order to experience the benefits of the anti-nausea effect. But I think including ginger in your diet is a good thing. And I think the evidence would suggest that it can be helpful for managing symptoms of nausea and vomiting. So I think using it is a good thing. I recommend the food form of ginger because I don't think that, broadly speaking, we have evidence to show that supplements help. You can make ginger tea by just steeping grated ginger in hot water. There are a lot of tea packets that contain ginger. There's also dried ginger chews that you can try. So you can also cook with ginger. So there's a lot of options. I think getting used to using it is it has a lot of health benefits, and it might really help. Turmeric is another one that comes up a lot. It's touted for its anti-inflammatory effects and especially having a helpful effect on joint pain. The rationale here is that curcumin is an active compound in turmeric that has anti-inflammatory properties and can protect cells from free radical damage. Um, I get asked about turmeric all the time, but I get asked about turmeric supplementation. And I think, there are a lot of reasons to consume turmeric in your diet. It does have anti-inflammatory properties that is indicated in the literature, but supplements contain very high doses to the levels of which you would never really consume in your diet. And so anytime you're taking a supplement, there is a risk that it can cause toxicity to your liver or digestive symptoms. And so I will say that I'm generally more comfortable with my patients consuming dietary forms of turmeric more than I am with a supplement. But the caveat always is that you should discuss individual supplements with your healthcare provider because there are reasons why someone might recommend something to you, and it's very specific to your medical history. So, dietary turmeric helpful supplements need to be discussed with a healthcare provider. And just if you're consuming turmeric, having it with a little bit of black pepper can help with your absorption of the beneficial curcumin properties. So, I have a few ways that turmeric can be used in the diet. I don't think it's necessarily the most common spice in the United States, but these are some of the ways I like to use it in scrambled eggs, in rice, in roasted vegetables, and even in smoothies. But probably the most common one is in this golden milk. Golden milk is basically just, it's another warm beverage, so it could be comforting, but you basically choose, take a milk of your choice, combine it with turmeric, black pepper, and maybe some cinnamon just for flavor and maybe some sweetener. I have maple syrup or honey here. And it's a really nice, warm, comforting beverage that has anti-inflammatory properties. And you could do this daily, not just when you're experiencing digestive upset. But I think it's a great nutrient to include in your diet more regularly. And I don't think a lot of us are using turmeric enough. Um, and then peppermint. Peppermint is largely recommended for symptoms of abdominal pain, indigestion, gas, and bloating. And the rationale here is that it's an antispasmodic. It helps relax the smooth muscles of the digestive tract and reduces hypersensitivity to pain. Um, Most of the research for the use of peppermint is in irritable bowel syndrome, not celiac disease, and not following a gluten exposure. Um, what's kind of interesting though is that it's one of the most commonly recommended supplements for people who have irritable bowel syndrome. So if you're experiencing symptoms of irritable bowel syndrome, I think it's worth speaking with your healthcare provider about it. I've personally seen a lot of people have a benefit from using it for these symptoms, for abdominal pain and for gas and bloating. It's you can consume it through like an herbal tea or even, use it in cooking. But the form that's been studied the most is actually in a capsule. So again, you always want to talk about supplements with your healthcare provider, but there is evidence for the use of this, and I think in my experience, it can be very helpful. All right, and just a few myths before we wrap up, because what would one of my presentations be without a myth busting? Um, these are some of the things that I have not found to be helpful, and there is no evidence for. So, activated charcoal, there is no evidence for number one, efficacy for removing the effects of a gluten exposure or safety. And so this is not something that I recommend. I do see it a lot online, but at this point, there's no evidence to suggest that it will be helpful in the scientific literature. There's also a lot out there about digestive enzymes, and I think just I want to talk about the concept of digestive enzymes a little bit. There are no digestive enzyme products available for removing gluten, removing the gluten proteins, or even breaking them down. There is really no evidence for the use of digestive enzymes in celiac disease at all, at least from an efficacy standpoint. But there is evidence for the use of enzymes for other reasons, lactose intolerance, pancreatic insufficiency, different carbohydrate intolerances. So there are some formulations of digestive enzymes that can be helpful for symptom relief. But my caveat to that is they're only helpful if you are taking them for another condition or food intolerance. So I don't think broadly recommending digestive enzymes is helpful for this particular case, which we're talking about being exposed to gluten. And for that reason, I'm not saying that they're helpful. But if, for example, you know you are lactose intolerant and you're taking a lactase supplement, that actually can be helpful, and there is evidence for that. So enzymes are, they have their role, just not for minimizing the gluten exposure. And then detox diets and cleanses. This is kind of broadly speaking, not just related to gluten exposure, but your liver does an amazing job of detoxification on its own. The best thing you can do to support your liver's detoxification process is to consume a diet that's full of plants. And that diet, if it's full of plants, will contain a lot of antioxidants and inflammation fighting foods. And so, of course, you want your liver to be healthy. Of course, we want to get more antioxidants into the body, but you don't need to do a cleanse or any crazy elimination protocol to achieve that. Um, at this point, we don't have any evidence at all that those things work. And actually, oftentimes they can be very supplement heavy, which is potentially dangerous to your liver. And also the restriction from a dietary perspective can put you at risk for missing out on important nutrients. So there's no reason to go for a cleanse if you've been exposed to gluten. So just before I wrap up, I'm not sure if Dr. Badalian is back yet, but if not, we'll just move to the cooking demo until he
Yep.
gets here. Oh, he's here. Okay,
I'm
great.
I'm actually bad. I apologize. I don't know what happened. My Zoom just shut down on me. So
Great.
I
I'll just
think
wrap up on this slide. I mean, and then we'll turn it back over to you. I think so. Just, as a dietitian, the best things you can do, continue following a gluten-free diet, give yourself time to rest and recover and do what's right for your body. There's no cure all, there's no magic bullet, but supportive nutrition may help with symptom relief. And if any of these things stood out to you, I think there's evidence for them in terms of symptom control, but not necessarily for gluten exposure directly. So take what makes sense to you and yeah, just be gentle with yourself. And I will stop sharing.
okay. So Megan, how much time do I have now?
You're fine, Vahe. You can go ahead and do the whole thing.
Yeah,
Okay, let me
I
see.
think like 15, 20 minutes, you're good.
Okay, I'll go relatively quick then, so we have time. Um, so I don't know where I lost you, but I'm gonna just go over this really quickly. So celiac disease, during the celiac disease, there's so many complex changes that are happening with the immune system, and we're still kind of investigating and studying and learning about this. But what is interesting is that IL-2, which is an interleukin-2, that's a chemical that our immune system is making, and it plays a significant role in our immune defenses. IL-2 seems to be playing a key role in celiac disease. And when IL-2, when people looked at IL-2 in correlation with symptoms of gluten exposure, some studies have shown that the higher is the IL-2 level made by those cells, that seems to correlate with severity of the symptoms in patients, specifically vomiting, nausea, and abdominal pain. So when people get gluten exposures, when they get accidental gluten exposures, um, of course, there's probably a whole lot of other cytokines that play a role, but in my mind, I'm thinking, okay, this must be the IL-2 doing all kinds of things. On the other hand, what's a little bit puzzling is, there's a lot of patients that get gluten exposures, but they don't really have symptoms. So what happens in those patients? Do their IL-2 levels go up? And if they go up, why is it that they're not reacting? Unfortunately, we still don't know a whole lot about this fascinating condition. But patients would ask me, okay, how do the symptoms change when we start on a gluten-free diet? I'll probably skip a few slides because we may not have a lot of time, but I use existing studies. This one is from Chicago, and it shows pediatric patients and adult patients. And on the left side is the pediatric patient symptom change. On the right side is the adult patient symptom change. And basically, the authors found that a proportion of the patients with symptoms such as abdominal pain, diarrhea, bloating, starts to go down within months. In some cases, even quicker, but at the same time, there is still a significant chunk of the patients who experience symptoms even a year or more after they adopted a gluten-free diet. Here's another study from Germany, essentially illustrating the same point where a proportion of the patients with abdominal pain drops within about 3 months quite drastically, and same thing applies to a lot of other intestinal symptoms. Well, the patients will ask me, how quickly is our blood work going to go down? When should we see improvement of the blood work? Here's a study that looked at that within about 3 months of starting gluten-free diet, the tissue transglutaminase markers dropped from about 70 times the upper limit of normal down to about 5 times the upper limit of normal. Of course, it's still not normal. It's still very elevated, but you can imagine the rate of the change here. On the other hand, when people look to see how quickly it will normalize, it definitely takes a long time. It can take a year, two, even more, as shown on this slide. And it, of course, depends on whether the patient started with very high tissue transglutaminase levels, whether their intestinal changes were more pronounced or less pronounced. Those factors will play a role. And of course, other factors as well, such as adherence to the gluten-free diet. Patients will ask me, okay, we have normal tissue transglutaminase levels and the follow-up, does it mean that our intestines are healed? Well, unfortunately, there isn't really a perfect correlation. The meta-analysis that was published a while ago now looked at high-quality articles trying to find a correlation, and what they found is that the specificity of the blood work to predict for the villus atrophy is about 83%, while the sensitivity is 50%. So what does it mean? Well, if the patient's intestines are still inflamed, there's about 50% chance that their celiac marker is going to be normal. So on the one hand, when we see the normal blood results at the follow-up visits, we're happy, we're giving high five to the patients. Okay, you're doing a great job. But on the other hand, this finding is very sobering that the normal blood work doesn't necessarily always means normal biopsies. Well, then the patients will ask, well, when should we expect our intestines to heal? We're not going to get multiple endoscopies. What's to expect? This slide shows the results of a study that was recently published from pediatric celiac centers, and our center was one of the participants. We looked back retrospectively, so this is not a perfect study because we're only looking at the medical records. But there seems to be a subgroup of the patients with pediatric celiac disease who have to undergo repeat endoscopies. The reasons for that may include the fact that patients also had eosinophils in their esophagus or have eosinophilic esophagitis. And typically for that condition, one has to undergo multiple follow-up biopsies once they go on a diet change or start medications. So we were able to accumulate a decent number of patients who underwent repeat endoscopies within about 15 months from their original endoscopy. And the graph on the left side shows that essentially within about the first 3 months, of the 25 patients who had to go under and get another endoscopy within 3 months, about half of them already showed the recovery of their intestinal mucosa. On the other hand, there is a 20% of the patient population that even after a year, they still haven't achieved recovery of their mucosa. The diagram on the right side illustrates again the point that serology, which is the blood work, is not always correlating with the biopsy results. For example, in the left arm of this chart, about 31 patients still had elevated blood work, despite the fact that they had normal mucosal recovery. On the other hand, patients that had normal blood levels, in about 8 patients, had normal blood levels, but then the biopsies were not normal. Unfortunately, even despite the best efforts of the patients still get exposed to gluten on a regular basis. This is a study that was done on adult patients with celiac disease who have been experienced with gluten-free diet. They've been doing this for about 2 years, and investigators collected their urine and stool and serum, and they were able to detect gluten in the urine and stool, illustrating the point that unfortunately gluten being everywhere, it's very, very hard to stay away from it. Having said that, the blood work doesn't always correlate with that. So people can have frequent exposures to gluten and still have normal celiac markers when you do the blood work. Here's another study that was done in Boston, also called doggy bag study, where investigators collected the urine, stool, patients completed questionnaires. They also collected the food samples from the patients, representative samples of the food that patients were eating, and they were able to conclude that a majority of the patients still were getting exposed to gluten. What is a safe intake of gluten? I will probably not dwell a whole lot on these old studies that I meant to discuss, but the bottom line is that less than 10 milligrams of gluten seems to be okay when patients are exposed to it long term. However, 10 milligrams is such a minuscule amount of gluten that it's really, really hard in real life to ensure that people don't get more than that. This study shows volunteers with celiac disease were given gluten 10 milligrams per day or 50 milligrams per day. They underwent endoscopies, and while 10 milligram per day group didn't necessarily have clear changes, 50 milligram per group 50 milligram per day group did have biopsy changes within about 90 days. Systematic reviews for that reason have concluded that less than 10 milligrams of gluten per day exposure is unlikely to cause mucosal abnormalities, but more than that certainly potentially can be harmful. Having said that, there's always a patient that may have such a sensitive immune system that even 10 milligrams per day will be enough to trigger their immune system and lead to mucosal damage. How quickly will mucosal changes occur if patient, let's say, gets a gluten challenge? So we typically will do gluten challenge for a variety of clinical and research reasons, but let's say if the patient um, starts to have quote unquote normal amounts of gluten after their intestine has been healed, how quickly will we see mucosal changes? Well, it turns out that the mucosal changes will occur fairly quickly. This is a study that was done more than 10 years ago, but it's been quoted in multiple papers. 20 adults with celiac disease who had very good control of their disease were recruited, and they essentially had an endoscopy at the beginning of the trial, and then on day 3 and on day 14 after taking daily gluten, 3 milligrams or 7.5 milligrams, which is about 2-3 slices of bread per day for 2 weeks. And investigators learned that fairly quickly, within this short amount of time, 2 weeks, they can find mucosal changes. So damage has been seen already within such a short amount of time. On the other hand, the blood work doesn't necessarily indicate any worsening, except a few more weeks after the gluten challenge. So blood work is always delayed relative to the mucosal changes. This is from another study, again, looking at 2-week challenge of adult patients. Similar sort of findings. This study was unique also in a sense that it found that interleukin 2, which is that key cytokine, rises very quickly within about 4 hours when the patient starts eating gluten. And higher amounts of gluten led to mucosal changes, but not necessarily the lower amounts of gluten. So 3 grams of gluten per day did not seem to register mucosal changes within this short period of challenge, as opposed to 10 grams of gluten per day. How quickly will mucosa heal? We don't really know. We don't really know a lot about if patient undergoes gluten challenge, how quickly their mucosa goes back to the normal. But this particular study from Boston was able to at least give some idea, because they also, when they finished the gluten challenge, that 2-week gluten challenge, they had a capsule study for these patients, and capsule study showed that about a month after the gluten challenge was over, their intestine appeared to be back to the baseline based on the capsule. Of course, biopsies were not done, so that's the limitation, but nevertheless, seems to be reassuring. But the patients will ask us, well, we're not going to do gluten challenge. We're not going to knowingly go and start eating gluten. What if we get accidents, sporadic gluten exposure? How is that going to affect our intestines? We don't know really because there's not that many studies on this. We don't know whether it's the dose of the gluten. We don't know whether it's the frequency. Is it once a week? Is it once a month? Is it once every 3 months? Or how long does it take for us to see any kind of mucosal changes? But I was able to find a study that was published in 2020. This is from Italy, I believe. And basically, they looked at 100 patients with adult patients who had celiac disease, and they asked them whether they were occasionally exposed to gluten. And these patients said that, yeah, we're take gluten accidentally or maybe sometimes on purpose, sometimes once a month, and some patients even reported weekly gluten exposures that they were pretty sure about. And when these patients underwent endoscopies, surprisingly, a significant proportion of these patients had normal biopsies. Of course, the limitation of the study is that the amount of the gluten exposure was not quantified. This was sort of based on the patient's food diaries, and people had to do some kind of backtracking and calculating roughly how much gluten that comes to. Um, Nevertheless, somewhat surprisingly, a good chunk of these patients, when they get sporadic exposures to gluten, do not necessarily have abnormal mucosal biopsies. Again, going to the gluten challenge, why would somebody need to have a gluten challenge? There's clinical reasons and there are research reasons. So clinical reasons include cases when we're not 100% sure whether the patient had correct diagnosis made. Sometimes patients will wait for to be seen by gastroenterologists so long that they will have to go on a reduced gluten diet or maybe go gluten-free because they're just having so many symptoms. And there could be also family members of patients with celiac disease who already have natural reduction of their gluten intake because their other family members are on a gluten-free diet. But when these patients get screened for blood work, their celiac markers are mildly elevated, but then let's say you're not sure if you should do the biopsy right now or should we increase their gluten intake before you do the biopsies. So these patients would be good candidates for a gluten challenge if they can tolerate it. And of course, there's a lot of research reasons for the gluten challenge because more and more potential medications are being studied, and for researchers to conclusively know whether the medication is working or not, they have to unfortunately subject the patients to the gluten challenge, as unpleasant as it is, to be able to conclude that. Um, how to do the gluten challenge. So if somebody agrees to do a gluten challenge, whether it's in a clinical setting or not, how should they do it? Our pediatric colleagues recently published this guidance on how to do it. So in a pediatric field, they suggested at least 3 to 6 grams of gluten per day for at least about 12 weeks so that we can have better accuracy of celiac diagnosis. And of course, it's not always easy to do this because patients can have severe symptoms. On the other hand, if patients have mild symptoms, it's suggested even to go higher than 3 to 6 grams. So three grams is roughly about 1.5 slices of bread. And certainly if the patient can tolerate, they should try to have more. On the other hand, if the patient has moderate or severe symptoms from gluten, maybe in those cases, patients can have shorter duration of challenge. Maybe they can consider ramping up very slowly the amount of gluten that they take. Sometimes that can help tolerate the gluten better. And they also may try to treat the symptoms of gluten exposure using different medications. The question that we get asked from the patients is, well, why would I do this knowingly when I know that this is hurting, and why should I do it so long? Unfortunately, right now, again, we don't really have perfect tools to be able to conclude whether the patient um, has it without having to go through this unnecessary pain, unfortunately. For the pediatric patients, one thing that I would say is that gluten challenge is not recommended when the patients are very young or the patients are going through the period of puberty, because we worry that that might compromise their growth and development. On the other hand, if patients are not having a lot of symptoms, um, some suggested that they can undergo gluten challenge really anytime. In the adult world, the factors that may prevent them from undergoing gluten challenge typically include pregnancy and maybe some severe, again, neurologic symptoms like ataxia or some other neurologic symptoms that can be preventing them from that. Our colleagues in the pediatric world, they published this sort of helpful guideline for the patients when they have to go on a gluten challenge at home, to provide estimates of gluten contents for different kinds of foods that I share with my patients. Um, and I guess the last few slides I will talk about managing accidental gluten exposures. Again, unfortunately, even in the best and most reliable patients, accidents can happen. There could be GI symptoms, there could be extraintestinal symptoms. When it comes to the GI symptoms, typical things what patients would tell me is that they have vomiting, nausea, belly pain, diarrhea, and commonly it just has to be supportive care. There isn't really a magic pill for this yet. People need to focus on preventing dehydration, maybe sipping small amounts of fluids, broths, maybe avoiding solid food for the time being. If their providers gave them prescriptions of Zofran or other medications, they can try that to see whether that can help the vomiting. Natural options definitely can be tried, ginger ale. For abdominal pain, again, it's supportive care, heat pads, ideally less medicine, but certainly pain medications can be tried as well. Consider peppermint, antispasmodics, antacids, and bland diet. Bloating, a lot of times patients will try Gas-X and other medications to reduce the gas. For diarrhea, certainly people can just focus on hydration, and with the physician guidance, they can try sometimes the antidiarrheal medications. When it comes to constipation, it's sort of the opposite needs to be done, using a lot of laxatives. It's a little bit tougher to deal with the extra intestinal symptoms, headaches, migraines, brain fog, fatigue. How do you treat that with medication? Unfortunately, there isn't really a lot of options. So we would just tell the patients to rest, hydrate, use pain medications for headaches or joint pain, if it helps. I hope that I didn't really go too fast, but the take-home points are that there is different timelines for healing among individuals with celiac disease. Serology doesn't always indicate normal biopsies. Um, Accidental sporadic gluten exposures in patients that are really sticking to the gluten-free diet probably are unlikely to cause long-term harm, but we need more studies. There's very, very little evidence for this kind of a statement, but I think when you ask the experts, they all kind of, maybe it's a wishful thinking, they all kind of tend to think that very rare sporadic exposures are probably going to be okay for the patient. Gluten challenge, unfortunately, is essential, and it's a necessary pain when it comes to diagnosing cases that are not clear cut. And of course, gluten challenge is really important when it comes to studying new therapies, medications. Short-term gluten challenge, if people have to go through it, typically short-term challenges are couple of weeks. Again, evidence is very limited, but it's somewhat hopeful that short-term challenges, even those massive doses of gluten, are not likely to lead to lasting effects on patients' health. I think that was the last slide. So thank you for your attention. I'm going to stop sharing my slides.
Great. Thank you.
Thank you, Dr. Stallion. All right, so Megan's going to go ahead and put the cooking demonstration up. Oh, Megan, you need to share the sound. Great presentation leading up to this. We've all been there where our tummies don't feel great, and it's really important to be careful about what we put in our bodies and eat in those moments. And so today we're going to talk about two recipes that are very soothing to our stomachs, very easy to digest, and most importantly, really easy to make. So the first recipe that we're going to make are carrot souffles. This is an all-time favorite recipe, one that I make with my kids and their friends all the time for a few reasons. One, it's really simple. It uses very few ingredients. It's easy to just pop in the oven and have ready for dinner. They stay great in the refrigerator and can be heated up the next day in the microwave. And well, they just taste really good. So the carrot souffle uses just a few ingredients. We're going to start with 2 pounds of carrots. These are just baby carrots that have been washed and peeled already. You can use any type of carrot you want. Just wash them, peel them, and chop them up. You need about 2 pounds of them. In this bowl, I have the carrots, and I've filled it about halfway with water. We're going to steam these carrots for 5 minutes in the microwave to get them nice and soft. Now, what's great about carrots is that they are naturally easy to digest, especially when they're cooked. They're rich in soluble fiber, which makes them very, very easy to digest, and they taste great. So they're the perfect vegetable to use for these souffles. So I'm going to go ahead and pop these in the microwave for 5 minutes. All right, so the carrots have come out of the microwave. They were in for 5 minutes, and now I've let them cool for about 5 minutes so that I can, one, touch the bowl, and also that they're not steaming hot. I also drained the excess water out of the bottom because we don't want that extra water in our souffles. It will make them harder to rise. So we're going to go ahead and put the carrots into the food processor so that we can puree them up. There we go. And we're going to puree them until smooth. All right. Now we're going to add in the rest of our ingredients, which is very simple. This is a half a cup of butter. You can make these dairy-free by using alternative types of butter. You could use an avocado oil butter, for example. You could actually put avocados in this if you wanted to, or any other dairy-free butter of your choice. This is some maple syrup. We're actually going to mix the sweeteners in this and use 2 tablespoons of maple syrup and 2 tablespoons of sugar. And then we have 2 tablespoons of gluten-free all-purpose flour. I always pick a gluten-free all-purpose flour that has a gum in it so I don't have to add xanthan or guar gum to my baking. So this one already has one mixed into it. And of course, we need baking powder to help the souffles rise. So this is 2 teaspoons of baking powder. And then we're going to add 1 teaspoon of vanilla extract and 3 eggs. So we'll put all those ingredients in and we will puree them up. Now we are going to scrape down the edges and just do it for another minute or so to get it nice and smooth. Okay, so we are ready to put our souffles together. So I'm going to go ahead and take this off just so I can move it a little bit closer. I have 6 ramekins here that I put on my baking sheet, and I'm going to spray them with nonstick spray just to make it easier to get out of the pan later. And spray the sides of all of them. You could also use the wrapper from the butter. You could just use your fingers and rub some butter on it, some oil, whatever you have in your kitchen. You don't have to use an actual nonstick spray, but I happen to have one in my pantry, so that's what we're going to use today. So then I'm using a cookie scooper here just to help me with dipping this. You don't have to. You could pour these into a measuring cup and pour it in. However is easiest for you. You could use a spoon or a ladle. There's no right or wrong way to do it. I'm going to fill it about 3/4 full. You don't want to fill it totally to the top because these are going to rise quite a bit. And you don't want them to overflow in the oven. So don't go above the ridge line on your ramekins. Okay, We're gonna go ahead and put these in the oven for about 1 hour, and then we'll take them out and we'll have our beautiful soufflés. So our carrot soufflés are in the oven, and so we're going to make an incredibly delicious chicken broth. So there are multiple ways to do this. And everybody always says that grandma's chicken soup heals the soul and any ailments that come with your body. And I completely believe that to be true. Anytime I'm sick, anytime my kids are sick, all I want is chicken soup. And so we're going to talk about how to make the broth for that today, which you can then add whatever you want into it. You can add noodles into it, gluten-free pasta. You can add rice into it. You can add gluten-free orzo, any vegetables that you want. There's also lots of ways that you can get the chicken into it. So the first way is to take an entirely raw whole chicken and just put it into the pot and cook it down for hours and hours. Now, Megan here on the webinar, she's been reminding me for the last 2 weeks about this cooking demo, but of course life got in the way and I didn't have time this morning to start the chicken and have 8 to 12 hours to let it cook the entire day to make this video. So instead, I did the next best thing. I got a gluten-free labeled rotisserie chicken from the store, and I asked for one that wasn't fully cooked all the way. You could do that. Just ask the butcher behind the counter for one that's still roasting, and if you're lucky, they'll take one off for you. So that's exactly what I did today. This is a rotisserie chicken that has been seasoned only with salt. So it is very plain. It was rubbed with a little bit of vegetable oil and salt before I just dropped it into my pot. So I'm now going to add a little bit of mirepoix or some vegetables for flavor. So we have some chopped onion and some garlic and some baby carrots. And that's all we're going to add to it. Going to pour water over the pot and then we're going to let this simmer. Right now it's about 2 o'clock and I'm going to hope for this to be ready for dinner for my family around 6 p.m. So good 3.5, 4 hours. We're going to let this cook on the stove. And while it cooks, we're going to talk about all of the benefits of chicken soup. There's something deeply comforting about the sound of a pot of chicken stock simmering away. It's not just cozy, it's healing. Chicken broth is rich in nutrients like collagen, gelatin, and amino acids that support your gut, boost immunity, and reduce inflammation. It's hydrating and easy to digest, which makes it perfect when you're not feeling your best, whether you're fighting a cold or dealing with an upset stomach. Here's a tip. For the richest flavor, start your broth with a mix of bones and meat, like a whole chicken or leftover roasted bones. Add carrots, celery, onions, garlic, and sometimes even a splash of apple cider vinegar to help extract the extra minerals. Let it simmer low and slow for at least 4 hours, longer if you can. Skim the foam off the top during the first hour to keep it clear and clean. Once it's ready, strain the broth through a fine mesh sieve and let it cool. You could also use a strainer for this. Just make sure that it has very, very fine openings. The broth will keep in the fridge for 5 days, or you can freeze it for months. Sometimes I like to freeze mine in silicone ice cube trays to make it perfect for adding a quick hit of flavor to sauces or sauteed vegetables. When it comes to gluten-free cooking, this broth will become your best friend. Use it to make soups like lemon ginger with orzo. Gluten-free orzo comes in lots of different varieties these days, or creamy chicken and rice soup. It's also perfect for the base of risottos, stews, or even a little bit stirred into your mashed potatoes. You can cook quinoa with it or gluten-free pasta in broth instead of water to add an incredible depth of flavor. So whether you're feeling under the weather or just want something nourishing and delicious, chicken broth is a pantry essential. It's soothing, satisfying, and endlessly versatile. So our soufflés have come out of the oven, and if we can zoom in down here, you can see that they're done when they've started to pull away around the edges. We know now that they've cooked all the way through. The center is no longer jiggly, and they're absolutely perfect and ready to eat. So to top these off at the very end, you could eat them just like this. You could put some chocolate chips on top, or today we are going to actually use some powdered sugar. So I'm just going to dust them with some powdered sugar, and then we'll let the kids dig into these for an after-school snack. There you've got our carrot soufflés.
Delicious.
Woo!
Okay, and this is a link to the recipe, everyone. This is on our website. I have the ingredients here, but if you just want to scan the QR code and we'll share it in the chat as well. Here's the instructions really quick. And that is it for our presentation today. I do just want to quickly, Vanessa, actually, you can take this part.
Sounds good. So, just like we did at the very beginning of the webinar and asked you to do a pre-survey, this is our post-survey for healthcare providers who are claiming CEU credits for today's webinar. You will need to complete this survey in order to get your certificate of completion. Patients and caregivers, we ask that you please complete this just so we can learn about your experience coming to the webinars and help us better understand what you may like to continue learning about from us in the future. We really appreciate you taking the time to fill these surveys out. It helps us make our programming better throughout the year. So thank you very much. And again, so the CEUs, how you get your credits. If you're a returning user, you can text to mark as present. The instructions for how to text are on the screen right now. You can take a screenshot of this to save it. If you are a first-time claimer of credits for this program, you will need to create an account at Boston Children's Hospital's CME program page. That website is up on the screen. It's dme.childrenshospital.org/account registration. We'll leave this here just for another moment so that you can take a screenshot of it or copy down the instructions. And then once you have registered, you will be able to text the codes after that.
Yeah, and I just texted the code and it worked well. So if anyone has any issues, we'll try to troubleshoot, but we'll also send this information in a follow-up email.
All right. And so I just want to thank again all of our speakers today. Megan for jumping in and just getting started quickly there. And Dr. Medallion, we're so sorry we lost you, but very glad you were able to rejoin and we could hear your wonderful talk. For everyone who joined, please save the date for August 5th, where we'll be doing our next webinar on celiac disease and parenthood, navigating fertility, pregnancy, and breastfeeding. And then October 15th, Beyond the Diagnosis, ensuring long-term health in celiac disease through follow-up care. The QR code on the screen will allow you to sign up for those just simply through the website. And just finally, another thank you to Shar. And for those of you who didn't get to meet her, to Emma Cousin, who behind the scenes has been helping us with links and sharing of websites throughout the webinar. Thank you very much. And finally, thank you to Eliana and Pilar, our two translators for today. So thank you everyone for joining, and we'll see you again next time.